For the first time in nearly 20 years, British lawmakers may soon have the chance to vote on the controversial issue of assisted dying. A bill which would allow some terminally ill people in England and Wales to end their lives is expected to be debated in September. Under the proposed new law, patients with no more than 6 months to live and who have demonstrated a clear intention to end their lives will be prescribed a lethal dose of drugs on the authority of 2 doctors. As a member of the House of Lords here in England, it's an issue I've personally spoken out against. But the arguments on both sides of the debate are complex and emotional. I sat down with 2 doctors, Jacky Davis, a consultant radiologist who is in support of assisted dying. It's a subject close to Jacky's heart, following the death of a brother from terminal cancer. And Andrew Fergusson from the organisation Care Not Killing, a doctor who has worked in medical ethics for over 2 decades. Dr Jacky Davis, Dr Andrew Fergusson, thank you for joining me. Dr Davis, if I could start with you. As a doctor, your job is to provide life-saving treatment, so why do you support this bill?
As a doctor, my job is to listen to what my patients want, and that may not always be life-saving treatment. For instance, people are perfectly able to reject any treatment that they don't want, and in fact patient choice, since I was a young doctor, patient choice has become a much bigger feature. 82% of the population in this country want a bill for assisted dying, and I think we should be listening to them. And the reason I'm listening to them is that I think the current law is broken. We're seeing very sad and really dreadful things happening at the moment. We've got one person a fortnight going to Switzerland while they're terminally ill to die before their time because they have to be able to travel in order to go there. We're seeing 300 people commit suicide while they're terminally ill, and we're seeing a significant percentage of people who are suffering at the end whose symptoms can't be relieved, so that's why I support the bill.
Dr Fergusson, you're against a change in the law. People would say that you lack compassion. Do you feel that?
I've certainly been in situations clinically where my first reaction, the first time I was asked to end a patient's life by the patient, my heart said yes for a few seconds, and then my head began to say no, and I began my response by saying, I can't do that, it's against the law. And I was very glad to be able to begin my conversation with that. It's not necessary to kill patients on the grounds of compassion. We do not have to kill them to end the pain. In the 20 years or so I've been campaigning against this, we've seen a huge shift away from the dying in terrible pain argument towards the autonomy argument. And we see this in the US state of Oregon, where 91%, the top reason for people requesting assisted suicide there is loss of autonomy. A little further behind, cannot do the things I want to do anymore. 71% loss of dignity. These are existential questions. They're not hard medical symptoms. And the answer to existential questions lies outside the scope of doctors and poison.
But how do we protect people who are vulnerable, who feel that they don't have any choice, who don't want to be a burden to their families, who are maybe looking at their grandchildren and thinking they want to pass the house on to them? How do we protect those people?
This law is based on the Oregon law, as my colleague here says, which is very, very prescriptive, and it has been working in Oregon for 18 years now. It's been adopted by 2 other US states, Vermont and Washington, and is being looked at by a number of other states because it's considered that it's been working safely. It's directed at terminally ill people who have 6 months to live, adults who are of sound mind, and that has to be adjudged by a psychiatrist if there's any question about it. So there is no leeway for it to affect vulnerable people who aren't in that situation. Clearly, if you're elderly and terminally ill, if you're a person with disabilities and terminally ill, you can call on the law. But if you're not terminally ill, the law is not available to you. And there's no evidence in Oregon. In fact, those groups that people are worried about, the elderly, people with disabilities, mentally ill people, are underrepresented in the people who've chosen to have assisted dying in the US. So there is no evidence in the jurisdictions where the law that we are being offered, there's no evidence that this is happening.
But isn't there a case for better palliative care rather than ending somebody's life?
I don't think the two are mutually exclusive at all, and in fact 90% of the people who choose assisted dying in Oregon are already in palliative care. But as my colleague has said, there are things that people find very, very troubling at the end of life, like loss of dignity, that we absolutely cannot address, and that is their choice. We cannot say that's not a good reason at the end of your life to say I want to go a bit earlier. But I think it's really important to emphasise these are not people who want to die. These are people who want to live, but faced with imminent death, which they are because they don't take this medication until the end comes, they want control over their death, and we feel that that is an appropriate choice to give them.
Dr Fergusson.
The data from Oregon is incomplete. There's no compulsory reporting, there's no proactive or reactive investigation by authorities. The figures are rising year on year. Fewer than 5% of the people who end their lives under the Oregon Act have seen a psychiatrist or a psychologist. We've talked about some of the issues. In the neighbouring state of Washington, one of the top reasons is a fear of being a burden, a financial, emotional, a care burden to family and to society. What we should be looking at are countries very much like our own, Belgium and the Netherlands just across the North Sea, where in less than 15 years there have been the most shocking developments. What scares me most about Belgium, where 6% of all deaths now are by euthanasia or assisted suicide, what scares me most is the way it's just become so normalised in the way we think. It's just another therapeutic option. That's a counsel of despair.
I think it's quite wrong to compare what's happening in the Benelux countries with what's on offer here. What's on offer here is absolutely based on the law as we've seen it in Oregon for 18 years. There has been no slippery slope, no extension of the law. Psychiatrists are called in only if the two doctors are worried, and people often fall at that stage in terms of their criteria, so they may not even get to a psychiatrist because the two doctors have decided that's not right. And once the two doctors have checked the eligibility criteria, which are very strict, then there's a judicial review where the judge has to come in, review the case and say whether that's right. I would say to the opponents of this law, what are you going to say to the people who are going to Switzerland if they can afford £12,000, who are committing suicide, as my brother did with terminal cancer? At the end, they should have that choice to say, I've had enough, my life is completely miserable now, and we don't kill them. They ask for the medication, they have to be able to take it themselves. This is not euthanasia. And I would also contend very strongly it's not suicide, because these people don't want to die, they just want control in the face of death.
Those in favour of changing the law say that there are enough safeguards in the bill. Are you comfortable with any of those safeguards?
I think this is the best presented bill that we've had, and although it's a private member's bill, lacking government support, lacking the support of any political party or political leader, lacking the support of the medical profession, I think if we're not careful, we're going to listen to all this and accept it. I'd like to pick up on the question of loss of dignity. It's the loss of the sense of dignity that is the problem. And it's our duty as family, carers, professionals to do all we can in a holistic sense to restore that sense of dignity.
And when I hear that, MPs are against this and doctors are against it, first of all, I would say we don't know what doctors think. The BMA has never surveyed its 150,000 members, so we don't know. And the surveys that we've done suggest that probably about a third are for it, a third are against it, and a third think we should be neutral on the subject. We're seeing big changes around the world. The Canadian Medical Association is now assisting legislation in Canada. The big California Medical Association has moved to neutrality on this. It's something that will happen, and I think it really behoves doctors to get involved to make sure that there are safeguards, because the other thing is there are no safeguards at the moment. People are going abroad to die, they're committing suicide. Probably about 1,000 people in this country are being assisted by doctors to die every year behind closed doors. We don't know what's going on.
Dr Fergusson, you were shaking your head there. Do you think doctors support this?
It's at least 2 to 1 against this, and in the 25 years I've been involved in campaigning against this, there's been a much stronger shift towards an opposed position. I don't think there's a third of don't knows in the middle. The interesting thing is that the closer doctors are to the reality of dying people, the more strongly they're opposed. So in palliative care, 94, 95%, general practice, geriatric medicine and so on, all the Royal Colleges with the position are opposed to this. We cannot just have a mantra of patient choice. The best healthcare decisions come when it's a dialogue of 2 experts, the doctor, the health professional, who's an expert in her specialty, and the patient, who's an expert in 2 things, how he feels and what he wants. And when both of those are having an honest dialogue, almost all the current requests, and there are few for euthanasia in this country, simply disappear. Those fears are dealt with and those concerns go away.
Well, there's one more thing we know is the debate will go on and on. Dr Davis, Dr Fergusson, thank you very much.
Thank you.